Hello, everybody. Good morning, good afternoon, and good evening, and very warm welcome to our Nursing Now Challenge Immunization Advocacy Champions session at Pre-World Health Assembly 2022. My name is Muhammad Mudabbar. I'm a public health nurse and an immunization advocate from Sudan, and it's my pleasure to chair and moderate today's session titled Elevating the Voices of Nurses and Midwives for Vaccine Equity and Acceptance. Nurses are the key major playing in the routine immunization, not only through their contribution to deliver the vaccination in the difficult to reach villages or remote areas, but also through their advocacy and communication to raise the awareness and misconception regarding COVID-19 vaccination. So recently, WHO has adopted Immunization Agenda 2030, which is aimed to address the immunization challenges over the next decade and save over 50 million of lives. The COVID-19 pandemic reminded the world the power of the vaccine to fight diseases, save lives, and create better and future health. Immunization Advocacy Agenda 2030 aims to maintain an immunization for everyone for every part of the world. Today we will be on a journey that started a long time ago, last August, when Nursing Now Challenges, in partnership with Saving Vaccine Institute, launched a global solution challenges through their Nursing Now Challenge global solution initiative to elevate the voices and perspective of nurses and midwives with aim of influencing discussion and decision making on vaccine equity and acceptance at local, national, and global level. A group of young early career nurses who has come across various continents with different thoughts and ideas with one aim to address the issue of vaccine acceptance in their local community. These young advocates receive a 6 week of training course leading by a storytelling trainer. The young advocate have started their advocacy at their local communities and continue to share their experience across various nursing events such as ICN Congress. And they continue to inspire nurses to get involved in various immunization advocacy activities. Today, we will listen and hear from immunization advocacy champion about their advocacy project challenges while implementing their project. Before we are going to our immunization advocacy champion, we are glad to introduce our keynote speaker, Catherine Kane. Catherine Kane is a technical officer for the WHO Health Workforce Department, is a member of the WHO Health Workforce team responsible for advocacy and dissemination of the guidelines on health policy and system support to optimize community health worker program. She has experience with community health worker program at strategic and operational level through the WHO. Over to you, Catherine, to highlight your keynote speech.
Good morning, good afternoon, good evening, everybody. I'm very pleased to be joining you. I'm going to, I think the other speakers will give you a little bit more focus directly on routine immunization. I'm going to give you a little bit of a sense of where we are globally in terms of human resources for health and some specific vaccination thoughts. So overall, what's happening right now within COVID-19? We've got a global challenge with workforce readiness in terms of existing workforce shortages prior to COVID-19, the initial response with redeployment, protests, strikes, infections, and deaths, taking out workers from the available pool, to the current response where we're looking at rolling out vaccination for COVID-19. We're still having redeployment. There are continuing protests and labor actions. We have continuing infections, continuing deaths. This is compounded by service departures. So what are we looking at? What is critical within this? Vaccinating health workers, ensuring decent work, protecting health and care workers, allowing students to complete their education, providing continuing education for all health and care workers, and including women and ethnic minorities. What we're looking at is how to address the impact of COVID-19. As you can see here, we did a bit of a chart on the impact areas that are influencing how health workers are able to do their jobs, from availability and distribution to health challenges for health workers themselves, to social and well-being challenges and working conditions. And this includes lack of COVID-19 vaccination. So these are interconnected factors that are influencing the physical and mental well-being of health and care workers. They were selected, and we advocated for health and care workers to be a priority group for vaccination, with at least 3% allocated within every country's vaccines allocation both due to the chance of due to the obvious occupational risk of those who are patient forward, as you all know as nurses, and the risk of onward transmission to patients and within the rest of the health sector. Our ambition was to ensure that the world's health and care workers were prioritized for COVID-19 the first 100 days of 2021. Where are we now? We are now in the second ambition, which is to target vaccination of all health workers by the end of June 2022. What does that leave us? Well, we've got fully vaccinated, partially vaccinated, and not vaccinated. And we've divided this we've done ongoing calculations based on reporting from 128 countries around the world. And these are separated by the WHO regions, which are Africa, the Americas, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. You'll also see that we are looking at the COVID-19 vaccination as of March 2022. This was end of month. We are constantly receiving updates and looking at how to extrapolate information on from the countries who are reporting, from the number of countries reporting full vaccination, the number of countries that actually have enough vaccines among health workers to cover. And we're looking at that data based on the National Health Workforce accounts and the number of health workers who self-report as fully vaccinated. So this is not total. We're not going to achieve our ambitions. And there are a number of competing factors therein. So we've got vaccine equity. All of us know that it hasn't been fair. We know that certain countries vaccinated all of their populations before other countries even were getting vaccines. What we also have competing against this, though, is a set of thoughts, vaccine hesitancy. So what's in there? And all of you deal with this on a very regular basis. So you'll know that all health workers don't necessarily want to take vaccines. Why is that? Because they aren't receiving fair pay or coverage for sick leave, for example. So nurses who have to take a number of different contracts to be able to feed their families, to be able to make a decent living, don't want to have to take time out if they're sick from the vaccination. There's a little concern there. Where else? There are a lot of malign influences that you all have been dealing with for years as immunization champions that question the science behind vaccines. What we've got, the reason these vaccines came so quickly now was that there was back-end funding. We said to vaccines manufacturers, we will ensure, we will guarantee purchase at the end of the vaccines line. So don't worry about the costs putting in, because we guarantee we'll buy them. You don't have to think about that. We'll also ensure that you're sharing the genomic information about the virus lines. So we had immense collaboration. And the third part was we had political support. We had politicians saying, we should have vaccines. We will ensure that these make it through regulatory processes, and we will ensure that all of the steps that are regularly taken to ensure safe vaccines among the population happen. So these vaccines have undergone the exact same process as the ones that you distribute regularly. But interestingly, they had the back-end financing, they had the guarantees, they had the political support to expedite through the process. And that's really interesting. So as we look at hesitancy, not only among health workers, but from the population, you have the opportunity. You see right here, these steps, be the champion. You know how to talk to communities and how to convince people. You know how to lead by example. And convincing people isn't just telling them you should do this, because as we know, there's nothing worse than being told you should do this to make everybody dig in their heels like an Alabama mule and say, nope, not going to do it. You're telling me it's true. But you have the opportunity to present information in the way that you have learned as immunization champions. So what's next? Protecting and safeguarding health and care workers. You can't do your jobs unless you are protected and safeguarded. Look at that. So in the World Health Assembly in 2021, the member states, the world's countries said we must guarantee that we are investing in human resources for health workers. We are ensuring that they have the readiness, education, training, skills, and competencies to manage the pandemic, that all of the financing institutions ensure that they are adding to domestic financing. What does that mean? Your government's budget. So we are trying to ensure that there is the right financing for education, and that we get to long-term financing to ensure you can do your jobs. Political declaration. So we had at the UN General Assembly, they committed to healthier and safer workplaces, improve access to occupational health services, and take the steps to protect health and care workers from, and I'm sure that all of you have experienced one or more of these: violence, attacks, harassment, discriminatory practices, and to promote decent and safe working environment. What's the result of this? This is the exciting thing that I have gotten the opportunity to work on, especially over the past year. And this is the Global Health and Care Worker Compact that we are presenting to the World Health Assembly next week for you, with you, together with you. So we were told to create this. We talked to key informants, professional associations, ICN was among them. And we did interviews, we reviewed the literature, we conducted internal review and consultation among the emergencies department, occupational health and safety, infection prevention and control, gender and equity. We talked around the building to all of our experts and said, what do we need to ensure is in here? Then we talked to your governments and said, what do you need? How can we get you to accept this language and then take this into your national regulations, norms, and standards? And then we will next be, and this is my exciting thing, for you, we will be designing this Global Health and Care Compact technical guidance so that your governments can protect you. It has 4 domains and 10 areas of focus. If you'll see right here, the key areas are preventing harm, providing support, safeguarding rights, and ensuring inclusivity. Together with the Global Health and Care Worker Compact, we will be presenting 2 other elements at the World Health Assembly. Let me tell you quickly what happened last week for the nurses. The triad meeting between the International Council of Nurses, the International Confederation of Midwives, and WHO Nursing and Human Resources for Health all met for the global nursing priorities to talk about the global strategic directions for nursing and midwifery. So the policy priorities regard education, jobs, leadership, and service delivery. I'll give you just a second to take a look at some of these areas. You'll notice that there are little stars here. This is number 3. All of these stars are areas that you can join as champions. You're already champions, so lead the way. And each of these has indicators. You know that we count what we care about. So when we can count, when we can enumerate, we start putting the finance and the budget behind it. And we have the opportunity to advocate with communities, with ministries of finance, with partners to get these done. So the triad meeting last week had a focus on country level I can't say it. You can read it. I can read it. How to put it into action. We had almost 900 registrants from 165 countries, representing the highest level of nursing and midwifery in countries, in associations, along with regulators and educators. And we had country examples that we looked to the leadership nurses and midwives to take back to country to adapt to context. And the resulting statement, which is on our website, and I'll share that within the chat, reflects the discussions and the commitment to action relative to national roles and responsibilities. So action and collaboration. Oh my gosh, there is so much going on right now to address the challenges, which is, and this number has increased, confirmed cases rising, deaths rising. Official figures don't even represent the full total, which it will take us years to fully understand due to dramatic underreporting. What else? What other challenges? The triple burden of continuous response to COVID-19, regardless of a number of populations. And Amy, I'm betting that you've reflected in this, that think it's over. I'm able to do what I want to do now, so it must be over. Or that country is doing whatever it wants, so my country must be able to do that. So the continuing burden of response the continuing burden of maintaining essential health services, which I know that you're doing, especially with routine immunization, and then rolling out the new COVID-19 vaccines. And there's some really interesting ideas, and I'm really looking forward to hearing from you on how to combine routine immunization with the rollout of COVID-19 vaccines, getting mothers and their children, vaccinate the mothers for COVID-19, vaccinate the children for measles, mumps, rubella, polio. The lack of health workers. We've had 3 global pulse surveys in 2020, 2021, and 2022, with reporting from over 2/3 of countries globally. And in every single one of those surveys, the biggest challenge to providing health services is lack of health workers. And this is layered on pre-existing shortages. So there are national, regional, and global policy initiatives and processes going on at a rate that it's almost difficult to keep track of. The ACT-A, Access to COVID Tools, accelerating, which includes the COVID Vaccines Initiative, and the Health Systems Response Connector, which aims to ensure that the financing, health workforce, et cetera, are there to deliver diagnostics, treatments, and vaccines. The COVID-19 Vaccine Delivery Partnership, ensuring vaccines get to every country with equity and affordably. The African Union's new African Vaccine Acquisition Trust, which is really exciting, and the new Workforce Initiative that we'll hear more about during the World Health Assembly. Global action. The UN Secretary General has 2 different action areas on pandemic response. The Member States Working Group on Strengthening WHO Preparedness and Response to Health Emergencies, the Intergovernmental Negotiating Body that's in charge of developing a WHO Convention on Pandemics, and moving forward this resolution last year in the World Health Assembly on protecting, safeguarding, and investing in the health and care workforce, and the Working for Health Action Plan, and the Global Health and Care Worker Compact. And now we've got something new, but wait, there's more. The Italian-led G20 last year, as well as other regional and national initiatives, including President Biden's Health Worker Initiative that was announced last week, offer more opportunities for alignment, engagement, synergies. So with all of these, we actually looked through and said, for each LOE, line of effort, is there a health workforce component? Get shots in arms. I don't know about you, but I'm pretty certain that we need health workers. We need nurses. We need community health workers to get shots in arms. To bolster supply chain resilience. Yep, need health workers there too. Address information gaps and other gaps to increase vaccines uptake. Boy, oh boy, you all are the champions. The information gaps here, the key link to communities, understanding what's being said, what are the rumors, what are the fallacies, what's the desire, what are the barriers to uptake, and then also looking at how to get those shots in arms realistically to streamline processes and offer your good ideas. They're absolutely needed. Protecting, safeguarding, investing in health and care workers. That's not just ensuring that we do the Health and Care Worker Compact, it's ensuring that we're advocating with governments to ensure that you're getting fair salaries, that you have protection, that you have insurance, that you have the necessary occupational health and safety support, that you have the educational opportunities, both in your pre-service education and your continuing learning, as well as an education and training are slightly different, as well as the training that comes for new initiatives. So when you're learning about the COVID-19 virus, when you're learning about processes to distribute that, when you're learning about new things like Immunization Agenda 2030, all of those have some elements of new delivery of on-the-mark training, including what's been shared through the WHO Academy and with micro-credentialing and micro-learning and elements that you can perform on your own in your, I know I'm saying in your spare time. I know all of you don't have spare time, but when you have a corner and you want to learn more, take advantage of the new digital learning and micro-credentialing. We're working more and more, so that's recognized as part of your continuing education. Ensuring acute non-vaccine interventions. It's no good delivering vaccines if we're not ensuring that people get the treatment they need for cancer, get the treatment they need for non-communicable diseases, for other non-communicable diseases, for malaria, for diarrhea, for pneumonia, and then looking at strengthening global health security architecture. We are all but little cogs in that machine. Global health security architecture really comes down to, and this is a big launch that we just did yesterday, it comes down to strengthening public health. It doesn't come down to building a super force that responds to emergencies, because as many years as we've tried that, and I come from emergency management for about 15 years, as many years as we've tried to create super forces that we can jet around the world to solve this, COVID-19 has demonstrated so clearly that what we actually need is a public health workforce that is supported, protected, paid in order to ensure that we are improving public health, gaining community confidence, and much further, ensuring that we are making more resilient populations throughout the cycle. And that is where we're really going to strengthen global health security, because we have people who are public health professionals, and we have new ways of training and learning, and ways of learning how to redeploy the workforce for acute needs and ensure that we're continuing services. We launched the Public Health and Emergency Workforce Roadmap yesterday, and I'll add a link for that as well. I hope you'll take an opportunity to learn a bit more about this. It's a really new, exciting initiative that we're taking forward with a number of different partners, particularly from academia, to transform education and learning to meet the 21st century needs. Line of effort 4, here's some of the areas. What can you do? Here you go. Here's another 5. Achieve maximum vaccination coverage among the target group of health and care workers, as well as identifying vaccine hesitancy. All of these are areas that, although you might not see it in your everyday work, we know that you are leaders in these areas. We're also working for you and working for health to ensure that we are prepared to look at this. We will be looking next week at the World Health Assembly at the Working for Health Action Plan. We're looking for member states to endorse and welcome this action plan, which sets a pathway for the next, towards 2030, on how we are going to invest in the health and care workforce in all countries and support countries to have the right policy and operational environment. We're looking at the Global Health and Care Worker Compact. We're also submitting reports on the progress on the global strategy on human resources for health. What did it look like 5 years ago? What does it look like now? We're counting you. We are making the case for investing in you. And what is a growth field? Please stay in the field. Please advocate for your rights. And we're also reporting on the global code on migration that looks at how we are supporting and safeguarding countries that have a low workforce density, and ensuring that health workers have opportunities to learn and exchange and go back to their countries and keep participating. So I apologize. I think I've probably gone over time. I'm so excited to tell you what's going on in the global sense, but I'm really even more excited to learn your ideas, your initiatives. Thank you so much for having me.
Thank you so much, Catherine, for such nice presentation. You highlighted the importance of healthcare workers and also addresses the issue of vaccine hesitancy among healthcare workers. Now we will move to our first immunization advocacy champion speaker. Our first speaker for today's session is Rose Marie Nakami. Rose is a registered nurse and executive director of Readiness Africa, a health equity NGO in Uganda. Rose, today we will talk about how storytelling model work at Readiness Africa. Over to you, Rose, to share your immunization advocacy journey.
Thank you so much, Madba, for introducing me. Let me just get sure that you can see my screen, and then I'll begin shortly. So I'll be talking about how our storytelling works at Readiness Africa. So we generally utilize storytelling as a thermometer for the health system, the rural health system mainly, and then we use the themes to then tell us how to strengthen the health system and how to respond. So we start off by training the rural healthcare workers how to tell their stories, and then we collect these stories and publish these stories on the REM East Africa blog and the website. That's the website, and then we curate these stories to the public to generate discourse and build trust. And we identify emerging themes and galvanize them for advocacy. And as we are galvanizing the themes and making sure that they're getting into advocacy spaces, sometimes they get into in-service training and academia, and then CSO programming, and also we use them to catalyze partnerships towards improving in policy formulation, budgeting, and diplomacy. And another one is to make sure that they reach more members of the community, and that is through radio and television. So what do we basically do during the trainings? During the trainings, after we have trained the healthcare workers, we ask ourselves these questions: what has worked well, what has not worked, what are the recommendations, and how many stories have been collected, and how many people have told their stories. And these are basically rural healthcare workers that we are looking at. How many of them have told their stories? So the reason we do this is because in 2012, the VISO report, Volunteer Service Organization, talked about the lack of healthcare workers' voice in policy formulation. So we want to be able to measure the progress we're making in how many rural healthcare workers, most especially, are telling their stories, because those are the stories which matter according to, most especially in improving health of the poorest. And then immediately after the training, we assess the following: what are the in-kind contributions that have been availed by the institution? And this is mainly to measure how the co-creation bit of the training, and also the sustainability after the project has closed down, or after the grants have wore off. And also we ask, has the training created a difference in our team? That's for capacity building, and what could have been done better. We analyze the themes and use them to catalyze partnerships and mobilize resources to address the issues. And we use social media analytics to be able to gauge the public engagement with the stories. And then we assess also how many avenues have been used to publicize the stories. Next month after, these are some of the things we have seen with the stories. For example, through storytelling, we supported the raising of funds to make 1,000 personal protective equipment shields at the University of Manchester R&D lab, which were donated to Gulu Hospital in Uganda. Also, we have utilized the stories to help support improve mental health of healthcare workers. You can see a story here on my right. On the right of the screen, told by Nurse Maureen, for example, and she talks about how it's the failing to control COVID-19 transmission at the rural hospital. But also she talks about how she's struggling mentally to be able to do her job. And so we conducted the training, and through a partnership we catalyzed with Atlantic Institute based at Oxford University. And then we're able to train these healthcare workers in mental health support, responsive mental health support, and there were 15 of them. And so that is an example. And lastly, I would also talk about how we have utilized the stories in concerted advocacy with the global financing facility of the World Bank to change the health financing model for Uganda. Thank you so much.
Well, I'm going to go ahead and jump in here. My name is Vince Blazer. I'm the Director of Advocacy and Outreach for the Saving Vaccine Institute. I think Mohammed's, our chair's connection got disrupted there. So I'll go ahead and move to our next presentation, which one, I really appreciate that, Rose, and it really fascinating all of the pieces that you're trying to connect the frontline health worker, the health workers who you interviewed to directly to those policy discussions happening currently in Uganda. And it's really important to make that connection for the local to the national and global advocacy. I think we'll talk about that a little bit more in the panel discussion. So Mpo, are you on? Our next presenter is Mpo Shalele from Lesotho, but I think he is maybe also having some connectivity issues. Amy, why don't instead while Mpo tries to get connected, I'm gonna turn it over for Amy Staley, a nurse in New York City, to share a little bit of her experiences in advocating for immunization these last few months. Amy, over to you.
Hi, good morning, everyone. My name is Amy Staley, and I am a nurse at New York Presbyterian Weill Cornell Medical Center in New York City. I've been a proud member of the Nursing Now community for about a year now, and Mohammed asked this morning if I'd like to contribute to this, and I said, of course, the answer is yes. I applied to the Vaccine Equity and Acceptance Initiative for a variety of different reasons, but back in August of 2020, I had the opportunity to travel alongside 11 of my colleagues to a Florida hotspot to take care of some really critical COVID patients for a few weeks. And it was really such a rewarding and humbling experience. And this was back before we knew of any COVID vaccine in the works. And during one shift, a disaster nurse and I were talking about the possibility of a COVID vaccine someday. And I'm an optimist. So of course I said it'll happen in no time. And there's going to be this miracle drug that's going to help everybody. And she said, you know, a COVID vaccine really sounds like a Christmas miracle to you. And then on Christmas Eve that same year, I was working night shift at my job. I settled into my chair to chart on my patients, and the phone rang. It was the emergency room, and they said, the COVID vaccine is here and it's your turn. And I said, oh my goodness, this is my Christmas miracle. And then about a week later, I had the opportunity to join the vaccination team at my hospital and vaccinate some of my colleagues, the same people who I literally watched save my neighbors and my friends and our patients. And it was really just the most incredible way to say thank you. And I couldn't wait to share this with the nurses who I had worked with in Florida. So I snapped a shot of my vaccine card like everybody else did. And I texted it to everybody and I said, Santa came a day early this year. And I didn't hear back right away, but I knew that one of the nurses had just had a 6-month-old baby. So I assumed they were just enjoying the holidays together. And I waited a few weeks and I sent another text and I still hadn't heard back. And I ended up actually coming across her obituary online and found out that she had passed away before she could receive that vaccine herself. So there were many prominent moments which drove me to submit my application for this initiative with Nursing Now and the Sabin Vaccine Institute, but those are just a few. So I was lucky enough to be a winner of a storytelling course and gain these funds to submit my own project alongside 6 nurses from other countries who are really just the most inspiring and incredible people. Rose, Mohammed, and Mpo, who are here today. And I think that oftentimes underserved communities are silenced of their needs. And together, the 7 of us decided that we were going to make 2022 the year that the silence speaks. And I knew that I wanted to make a difference for these underserved communities. So I started here in New York with my own. I launched my initiative, Frontline Friends, which targets low-income communities due to the disadvantages that they face. I created COVID-19 vaccine resources and flyers and distributed them to 2 organizations here in New York City. The first, the New York Foundling, which is one of the largest adoption agencies in New York. And this place is really close to my heart because I actually worked for them with pregnant teens in foster care prior to becoming a nurse. So I always say that I became Miss Amy before I was Nurse Amy. And while Nurse Amy is one of the proudest titles that I've ever held in my entire life, Miss Amy is just as significant. And then I also worked with an organization called the Alliance for Positive Change, which runs several harm reduction centers throughout New York City. So it was brought to my attention by an individual who identifies as homeless that it's very difficult for those who do not have homes to obtain accurate information. So I was really grateful to have the opportunity to help this community as well. And I think that Catherine brought up a really important thing earlier. She said, the importance of the impact of how vaccines are distributed really affects as nurses, our ability to do our jobs properly. And that's so important because I think it's important to remember that this affects everyone, whether you're a nurse or not. And nursing now really gives you the opportunity to have your voice heard. I was speaking with Mohammed and Rose before this session about how things still aren't really normal and things may never really return to normal, but they can be even better than that if we make them out to be. Many say that nurses are the heart of healthcare. Everybody's been saying that over this past week, Nurses Week. And while that is true, we are a lot more than that. We are also the eyes of our physicians, and we're ears who listen beyond the chief complaints that come through our doors each day. And we can be the voices of our communities too, if we each just have the courage to step up and say yes. So thank you for giving me the opportunity to say yes today and to share with each of you. And I look forward to hearing your stories as well.
Thank you so much, Amy, for such very long presentation and sharing for a successful story. Of course, you are amazing as you are, Amy. So now we are moving to our panel discussion. I'm delighted to invite Vince Pleather. Vince is a director of advocacy and outreach and vaccine demand and acceptance at Sabin Vaccine Institute. So I'm delighted to invite him to moderate as a panel discussion. Also, I would like to invite Sanil from South Africa. Sanil, please join to our panel discussion. Also, our colleague Refiat. Also, Amy will be there, of course. Rosemary Nakami, Rashid Maganda. Adding to that, we are inviting Mofoshi Lely to our panel discussion. Over to you, Vince, to start the panel discussion.
Great, and thanks, Mohammed. And it's been a fascinating discussion so far. Before I get started on that, is Umpo, are you able to speak? I'm not sure if I'm okay. We're hoping to hear from one of the other immunization advocacy champions, Umpo Shalele from Lesotho, but unfortunately he's having some connectivity issues. But we will send to everybody some of the slides from his presentation and some fascinating things he has been engaged in Lesotho. So maybe just want to just start a discussion here. I think we've had a good discussion already in the chat as some of our presenters have gone on here. But just to kind of kick it off, I think that a lot of really interesting points have been hit on by Mohammed, Catherine, Rose, and Amy. We have this situation now. I think all of us have lived in different ways the challenges of this pandemic. Coming out, we have this, health workers have delivered, nurses and midwives in particular have delivered, the largest vaccine rollout in human history this last year and a half. And, vaccinated over 60% of the world in a year and a half. An amazing accomplishment. I think we've also, as people who work in public health or work in healthcare delivery, we see the inequities and the challenges and the people who are not getting them, and I think that it always drives us to do more. And I think that was brought out in the discussions today, and the inequities, those who have generally the most challenge in accessing all health services are the ones by and large who have received the least amount of benefit from the scientific innovation that vaccines were able to deliver. At the same time, there is this very concerning decline that the whole inequitable rollout of COVID-19 vaccines has brought on to routine vaccinations. Measles is up 400% in Africa this year. There's breakouts of polio, other vaccine preventable diseases. Every region is struggling in different ways with some of the declines in the very high rates that health workers have been able to deliver. So I think what we're hoping to, and we started the discussion today to really dive into is what has been a successful way that you have convinced people in your community of the importance of vaccination? How has that evolved, and what do you and other health workers really need to be able to really deliver on both on COVID vaccination, but also on making sure that people continue to go in and get their routine vaccinations? And so I think first I want to call on Staley from South Africa. I know, Staley, you shared some pieces in the chat there, but interested in hearing your thoughts on all of this. Over to you.
Thank you very much. I think what I've seen is that information works. The more information that is shared with people on various media platforms, then the more you can persuade them to actually go to the facilities and get vaccinated. So it's true, just like the other countries I saw in the chat, there was an issue where we had a backlog of children getting vaccinated during the pandemic because of the lockdowns. There was hard lockdowns, and then the lockdown is lifted. And then when the Department of Health actually realized what was happening, then they used various media platforms to reach out to parents and tell them to go and get their children vaccinated. And then we saw that the statistics for that also improved. So the key is really information. Yeah, that's my contribution.
Vince, I think you are muted, Vince.
Sorry, Vince, you're muted.
Vince, you are muted.
Oh, that, I was making such a great point. Okay, I'm curious that information, Staley. Do you feel like that information flow, that nurses have been getting the information they need on a timely basis, or do you feel like that there's something that needs to be done in government, by governments or WHO and others to make sure that nurses have the latest information? Because I know it's been a challenge during the pandemic.
Yes, with regards to the pandemic specifically, I must say that because most of the information is in journal articles, then it doesn't really filter down to everyone who's not really in an academic setting as quick as we would like it to be. But I think the World Health Organization did really great with the information that is there on the website, also written in layman's terms that everyone can understand. So then we're able to discuss it even on social media, to say this is the link for the World Health Organization if you want to know more. Because I think there was frequently asked questions. Yes, the World Health Organization had frequently asked questions and the answers to those questions. And that really, really helped, because then we could go there just on your phone, go on the website and access the information and share it, and even debate some of the information, because there were so many conspiracy theories. And at least everyone knows that the World Health Organization is a credible source of information. So that helped a lot.
Great, and maybe move to someone else to jump in, and perhaps I can call on Zipporah Regi from Kenya. I know that you shared some pieces in the chat too. Curious your experiences and any reactions to what you've heard so far. Zipporah, over to you.
Hi, everyone. I hope you can hear me.
Yes.
Thank you. So, like I said in the chat, there was a lot of lagging, as we were trying to roll out the vaccine in my country. And I think one of the major problems is especially because the healthcare workers were not volunteering themselves to get the vaccine for themselves. And I think that what majorly contributed to that was when the vaccine was started being rolled out in the country, it was more like a government initiative. They did not take time to actually teach us or involve us, the healthcare workers, about the vaccines, the side effects, what we would expect, what was required of us. They just brought the vaccines to the hospital and expected us to just give the vaccines. And whilst we are still struggling with our own ideas and knowledge of the vaccine, you see, then we cannot 100% believe in the vaccine and actually advocate for it to be given to people. But like Sanale said, as the government started rolling out a bit more information about the vaccine, even sharing the data of COVID patients, the number of people who are dying, those who are affected. And I think also as the vaccine continued to spread and people close to home, your friends and family get the vaccine, got COVID rather, we'd find that people would actually now start stepping up, actively looking for the vaccine. And once they get them, themselves are trying to pass on that information to their friends to get the vaccine. But something that we did as Kenya was that it got to a point where a few nurses were rallied in every county, and that they would be sent out to give vaccines to people in their homes, in the streets, just to get that conversation and ensure that we're getting as many vaccines into people's arms. And so we had those initiatives, where we would go to old people's homes, homes, in the markets, in the streets, just attend and request people to come and take vaccines. I think they were also visited churches and schools, just to ensure that we are getting the vaccines to people if they cannot come to the hospital and get them for themselves. Yeah.
Thanks, Zipporah. Yeah, and maybe just a quick follow-up. I know you talked a little bit too about just the importance that generally that health workers themselves had the same sort of questions or reluctance to be vaccinated, and that other health workers coming along has kind of improved things. Do you feel like going forward there's going to need to be new or additional programming of just talking to health workers themselves about the importance of themselves continuing to be updated on their vaccinations?
Yeah, I think that is important because the HCWs, the healthcare workers, are the ones who actually need to get shots into people's arms. So the more training we give to them, the more empowering we give them to be champions of the vaccine, and also just the basic training and gaining feedback from them. What have you heard from the community, because they are, like Amy said in her presentation, they are the ears, on the ground. So I think, it would be really important to keep engaging the healthcare worker in training, in championing for the vaccine, in giving information and using them and the position they hold at every level of healthcare to just be part of the conversation, and even encouraging them themselves to lead by example, by getting vaccines into their arms. I partly have gotten my 2 vaccines and booster shots. So yeah, thank you.
All right. Well, thank you, Zipporah. Maybe can move over. Is an interesting comment that that Rita, that you've been making about some of the financial situation in Lebanon and access for vaccination and routine. And so interested to hear a little bit more about that and kind of any issues that's having for health workers there. So Rita, interested to hear your perspective. I think you're on mute, Rita, if you were trying to talk. Okay, if Rita's not able to get off mute, I think I'll ask Abigail, I think you made a point about people with a certain condition, sickle cell. You mentioned in particular. Interested for you to expand on that a little bit more.
Yeah, so just a little bit of background. So my hospital, we take a lot of the sickle cell patients in the UK, and we have a really, really big demographic. In particular, my area, I work in haematology, so we do a lot of the blood exchanges for the patients with sickle, and essentially the uptake of the vaccine isn't there at all. And despite education from myself, the consultants, really senior people in within the teams, and despite obviously being from a BAME background, you're more likely to die of COVID. And those statistics, which are statistics that we obviously have, the uptake's not there. There's no trust about having the vaccines. And we've tried a lot of different educational ways to try and support it. But it's really, really difficult. And these patients are coming in really, really unwell, going straight to intensive care. And they see that some people have had family members die in intensive care and they still won't get the vaccine because I don't know, it's a combination of not believing that COVID is as bad as it is, but also that having the vaccine and how it was created so quickly, which I do understand that distrust. I do, because it happened really, really quickly. And when you see so much research going into drugs being created, it normally takes years and years and years, and so much goes into it. And it happened really, really quickly because of obviously the public health issue. So I do get that distrust with it. But yeah, the uptake is just not there, despite people coming in with COVID and being really, really unwell, and all those impacts post COVID. But the patients still aren't taking it, which is really, really difficult.
Yeah, I think that there's so many challenges, and I think that, I mean, maybe just what reflection of your story is just that maybe circling back to the theme of this session is that the experiences like that need to ensure that they are going up the chain, right? And in certain countries there may be more clear pathways to do that, and in some ways not. But I think the seven, Mohammed, as I turn it back over to you, the seven nurses that started this immunization advocacy champions did so in the thought of not just their own advocacy work, which they've all found different pathways to advocate for vaccination, both in their community, in their country, and here globally, but also to continue to communicate and share ideas with each other. And I think that stories like that we're going to continue to need to share if we have any hope of both of getting to the levels of at least 70% of the globe vaccinated from COVID-19. COVID is likely to become a regular immunization that's needed. So it goes back into those regular discussions of that long-term engagement that nurses and midwives and health workers are at the center of hearing from communities, understanding the nuances of issues, making sure that those who are in charge of health systems and health policy understand them, and if there needs to be change, whether it's the scope of practice, in scope of practice, or whether it's the need for prioritization of health workers in vaccination. I mean, it seems obvious, but we need to keep pounding home that point to make sure that health workers receive the priority they do to be vaccinated themselves against any infectious disease that may be circulating where they're working. There's all kinds of pieces, and Catherine laid out some really great so many great pieces that are happening regionally and globally on health workforce now. The Health and Healthcare Worker Compact, I think, is going to be a great framework to engage in your national associations in making sure that the rights and the perspectives of health workers continue to shine. And so, Mohammed, as I turn it back to you, I'll just say that really been inspired by the conversation. Look forward for it to continue, and look back to you for your closing thoughts, and especially your perspective in deciding that this was a priority for yourself amid a coup and security challenges that you've had there in Sudan. So Mohammed, back over to you to close our session.
Thank you so much, Vince, for such a wonderful word for that. For me personally, I'm struggling while implementing my challenges in Sudan. Especially, before the coup, I used to create the communication channels with managerial levels across federal health ministry of health. But after the coup, all people has been changing, and I lost my connections. And I used to start from the beginning and to raise my awareness, the advocacy of importance of inclusion of nurses in different parts of the lives of the country, and also through changing and modification of fighting misconceptions in social media, and also influencing the policymakers to adopt the issue of mass campaigning instead of regular campaigning in order to prevent the issue of vaccine losses. So that's my little bit quick experience during the time of the coup. Adding to that, for now we are reaching to our closing our session today. Thank you so much for your fruitful works. We are looking forward to hear for Q&A section for other participants. If anyone have a Q&A, if anyone have a question, we can handle it from here. For me personally, when it comes to the COVID-19 vaccination and the issue of the misconception and vaccine acceptance and hesitancy among Sudanese nurses, it's being alarming thing. Especially we are facing a gap between elderly people and young nurses. The majority of the people that are refusing to get vaccinated is the elderly nurses. So I try to talk to them, organizing sessions and training, and to address the issues of vaccine hesitancy and vaccine acceptance. Now, at the end of our session, I would like to thank all immunization advocacy champions for their fruitful presentation and for how they are making the impact during the local communities and for their efforts that have helped to address the issue of vaccine acceptance and hesitancy. Also, I would like to call upon action for all nurses who are watching today's sessions to get involved in the vaccine advocacy and communication and try to work and engage in their local communities and try to share their work using social media, #entitled WHA75. Thank you all for taking the time to attend this event. And again, our thanks to Immunization Advocacy Champion for their hard work. Many thanks to the panelists who joining us from different parts of the world. Also would like to send my sincere thanks to Catherine Kane for taking the time and to participate in our today's sessions. A warm thanks go to Sabin Vaccine Institute for supporting immunization advocacy champion activities. Also, last but not least, we would like to thank Nursing Now Challenge for their continued support, and special thanks go to those behind the scene, Antri and Hannah, for their continued support. Without them, we can't be here. Thanks. That's all. Thank you. See you again in the next few sessions.